Well, welcome. Hello, and welcome to our 2024 Department of Health listening session regarding behavioral health licensing. Thank you for participating. Please note that this meeting is being recorded. My name is Eve Austin, and I am one of the executive directors for the behavioral health professions within the Office of Health Professionals at the Department of Health, and I will be facilitating today's listening session. Now I'd like to have our other departmental staff on this webinar introduce themselves. Then I will give some instructions for Zoom. After that, we will hear a brief presentation on the department's efforts to improve our credentialing process. Then I will give an additional brief presentation on the recommendations we made in December to reduce barriers. Then we'll begin our listening session tonight and gather your comments. We have about 5 to 10 minutes left in the meeting, and we will wrap up comments and I'll provide a quick overview of the next steps. With that, I would like to ask our panelists to introduce themselves as I call on you. So I'll turn the floor over to Shauna.
Good evening. My name is Shauna Fox, and I'm the director for the Office of Health Professions. Thank you for being here tonight.
Harold.
Hello, my name is Harold Wright Jr., and I am the Deputy Director for the Office of Health Professions. And I too am excited to be here with you.
And I'll also invite Joe, if you're able to unmute.
Good evening, everybody. My name is Joe Miller, and I am Executive Director of the Behavioral Professions in the Office of Health Professions, and want to welcome you to this session tonight.
We do want to know that there are several more DOH staff on the webinar, including program managers for all the impacted professions and representatives for customer service. But in the interest of time, we will not have everyone introduce themselves. If you would like to contact any of the program managers, their contact information is on the second to the last slide of the slide deck, which will be shared with registrants, which was shared with registrants on Monday. Before we begin, we want to provide some basic instructions for how to interact with Zoom. You should see a control panel.
We don't have the PowerPoint up yet, and it's going to be hard for folks to use that instruction about it. Yeah. Well, could you share the PowerPoint with us, please?
Is it up now?
No.
Oh. Apologies, one sec.
Let me try, Will. Is everyone seeing it now?
Yes, that's great. Thank you, Eve.
Excellent. So sorry about that. All right. So before we begin, let's do some basic review of Zoom. You should see a control panel along the bottom of your screen. If your mouse has gone inactive, it may have minimized itself. So try shaking your mouse if you do not see the control panel. On the far left of your control panel is a button to mute and unmute yourself. The button is currently inactive, but we will enable your microphone if you raise your hand to speak. Towards the center of the control panel, you will see buttons to open the list of participants, the question and answer box, and the chat box. To the right of your control panel are options for closed captions, interpretation, and reactions. When we call for folks to raise their hand, you will find the hand raise button in the reactions menu. We are also providing American Sign Language and Spanish interpretation for this meeting. ASL interpreters should be pinned to your screen. If you cannot see the ASL interpreters, please put that in the chat and one of our team will enable that feature. If you'd like to switch your audio to Spanish interpretation, click on the globe-shaped icon in the bottom right of your screen that says interpretation underneath it and select Spanish to hear the translation audio. I would also like to remind everyone, if you're a fast talker like myself, please try to speak slowly to make it easier for our interpreters. Also, video is turned off for attendees by default. If you need to access your share video, please put that in the chat and we will enable that feature for you. Now, Zach, if you want to prepare your slide deck for sharing screen, I'm just going to do a brief note here. So the Office of Health Professions recently started a merger absorbing the credentialing function in efforts to support the credentialing process improvement. It has been a pleasure to be a part of this credentialing process improvement team, and I now support our agency-affiliated credential types, CARS, CALS, CAC, substance use disorder professionals, hypnotherapy, ABA, LABA, CBT, certified counselors and advisors, and the future credentials states with behavioral health support specialists and our peer support credentials. My team of program managers who guide the professions have merged with the credentialing staff on March 1. I am proud to share that we have improved communication, increased collaboration, and are seeing data-driven results, resulting in declines in our credentialing timeframes. My story is only one team's experience within the Office of Health Professions. I will share we continue to support these credential types in the next weeks and months in hopes to continue to decrease our processing timeframes. I will now turn the floor over to our Office Director, Shauna Miller, and the team to provide an overview of the work we've been performing.
Thank you, Eve. So one of the things we heard during our listening sessions last year were a lot of concerns about our internal processes and how difficult it was to communicate with our staff. And we heard you, although these sessions really are focused on policy, rule, and statute change that can support reducing barriers. However, we heard you. We recognized that there was an issue with our credentialing timeframes as well as our accessibility to our customers. And so with that, we embarked on a journey that has taken us through what we're now in the process of a reorganization of the whole division. And we're really proud of the work that started, just as Eve has outlined. So I'm going to hand it over to Zach Patnode, our quality administrator, along with Harold Wright Jr., to tell you a little bit about our process improvements. Harold and Zach.
Yes, hello. Thank you again. I'm just excited to be here tonight, or today, moving into the evening, to share with you from the pilot what we've learned and how it's impacting the reorganization now. So we're going to start by just saying, how do we reimagine profession credentialing? How do we do that? And we do that by running the pilot to figure out what is it that we can do and learn and glean from to apply for future state. So we picked psychology because it had multiple challenges, one of which was the complexities around the timelines. They could be extremely long. It requires communication amongst multiple offices. So you have to start very early. And if you don't get started very early, sometimes that can be disjointed and impact the timeline. It has independent authority. And however, the board has independent authority, but DOH produces the credential. And so there has to be communication between those two pieces as well. And so those are just some of the many challenges that we embarked upon when we went through the pilot. And so taking all that information, meeting with Shauna taking it to our leadership and saying, hey, look, we need to impact pending backlog of applications. We have to do that. And so can we run a pilot with some complexity and figure out ways that we can learn to impact? I said, yes, we need to get after that. So we kicked off the project March 9th, 2023. It was under a single leader, myself, and designated resources, Zach, and a team. And we focused on culture, communication, and yes, data. And now I'm going to pass it on over to Zach, and he's going to talk to you a little bit more about the approach and early accomplishments.
Thank you, Harold, and thank you everyone for having me. I am Zach Patnode. My title is Quality Assurance and Continuous Quality Improvement Administrator, and I was formerly the program manager for the psychology profession during the time of this project. And as Harold said, I'm going to talk through a little bit about the results of that pilot, some of the approach and the impact and change that we made in order to gain those results, and then moving forward into how we'll be using some of those same pieces with our reorganization across different professions as they fit. So first, one of the main areas or offenders, if you will, of the timelines around psychology were specifically our non-routine applications, which again, we mentioned that psychology is very complex. These non-routine are even more complex in terms of a slice of applications that come through. They require board review by a member or a 2-member team of the board to go through some detailed pieces. And this is an area where many of our longest turnaround times existed, was in this category. And so through adding resources in our pro tem board members, by recategorizing a number of applications into a more routine pathway and just general cleanup around many of our forms and other pieces. We were very, very successful in reducing that number from a starting point of 54 total down to about 12. We've maintained that for quite a long time with bumps up and down just slightly, but with a much lower level and sustained in that area. And so you see that on the left with the total non-routine with board. On the right, the non-routine process status count. The real highlight that I wanted to point to there is that red line starting up at 31, where these were applications that had not yet been reviewed by the board, had been labeled as non-routine and sent into the process, but there wasn't capacity to begin reviewing them. And so the changes that we made allowed us to reduce that number fairly quickly from 31 down to 0 and maintain that number now, where applications no longer wait after being assigned to the board, but can sometimes be allocated to their review team even the same day that they make it over to the board. Along with that, we made a number of other improvements to our data tracking tools and to the ways that we utilize our database as it exists today. That not only helped with non-routine, but our routine and temporary and endorsement substantial equivalency license applications. And so what you see here is data that would indicate that not only were we able to go and clean up applications that were aging to the effect of 121 of those, but also 123 applications that came in since the project started. And for those that are new coming into the process with our changes, we're averaging under 90 days in total for everything included. And again, that would include many that would go through faster than that, and then non-routines that may take longer with those longer processes through the board. But keeping that number low and both being able to clean up what was aged and improve our processes to take care of the new applications more efficiently. I've also brought a slide that shows a bit of our data tool and our scorecard that is meant to be able to track our progress across different professions. And this one specifically belongs to Eve's group and to behavioral health professions that live in the team that she manages and are relevant to this group, to show where our pending numbers are in terms of total applications, those awaiting final authorization or those awaiting initial intake. We're making progress. We're seeing reductions in those areas, and Harold will talk a little bit more about the specifics there. But we have tools that we developed and learned from in the psychology pilot that can now be put to use across the board in many different places. And we're really excited about what that means in the short term right now as we begin to learn and commence our reorg, but also over the long term to allow us to really reduce our turnaround times, our pending numbers, and then maintain them once they're there. And Harold, I'm going to kick back to you. Harold's going to talk a little bit about our cultural and interpersonal framework, because data and tools and processes are all great, but they really fall short if you don't also make adjustments with the people and the way that we think about and talk about our work. So Harold, I'll kick it back to you. Thank you.
Thank you, Zach. And that's exactly right. We want to be transformational with this work, right? And the way we do that is that we marry the data-driven tools with the framework, having the people understand and work in partnership with interested parties is what we need to do to drive long, sustainable change. Because the ultimate goal, again, is to access to care. We want to make sure we get folks out there to take care of the citizens of the state of Washington. And so some of that we learned from the pilot was, how should we frame up the receipt of application, issuance, and license? What does that process need to look like? Because that current process didn't work. So by looking at it, that current process contributed to long wait times and pending application lists. So in the pilot, we worked through process improvements to address that. How do we change and continuously improve? We have to make the invisible visible. We must. And we have to have people feel comfortable about data. Not about coming in and looking in to say something that we did wrong, no, but to figure out what we did right and to build upon it. And so those are the things that we learn with the cultural interpersonal framework, is how do we make the tools come alive? And then we have to maximize partnerships. We have to make sure the association and boards and legislation are providing feedback. And we're hearing from them so we can get that communication to be maximized. And then we also have to affirm and evaluate some of the things that came in the past for suggestions. Is it applicable here? Or should we use it in another part of the project? But all those things come to play when we're looking at and talking to people in terms of cementing the process. Next slide. Where are we today for professional credentialing? Where are we right now? Well, March 1, we transitioned in our behavioral health team. And I won't go through and read each one of these, but I will open it up for you to take a guy's head and haul and say, here's where we are right now. And so what I also want to talk about is that we have our last teams transitioning actually tomorrow, our last groups of transitions tomorrow. And so we're really excited for the lessons we learned from the March 1 transition of groups to the April 1st, and then now to our last group tomorrow, all the learning, all the things that we've done to come together and make this as seamless as possible. Now, there's a lot more work to this. So I'm going to get into the next steps now. Our next steps with all of that is to, again, ensure that we have data-driven management tools that are up to date in terms of the work and the progress that we're making. We're always talking about artifacting and learning and refining. So we're moving that from a weekly cadence, from a monthly to a weekly cadence. We're going to set meaningful targets. And then we're going to make sure we continue to policy, our alignment in our policy is there. We're going to evaluate technology. We're going to right size. We're going to figure out through efficiencies, is it the appropriate staffing for the work we have to do? Do we need to add more? Do we have to add less? How does that impact? And then we're going to continue to engage with our constituents. We're going to continue to update folks on where we are in the process. We're going to continue to work in refining our relationships with our boards and our commissions. I'd like to turn it back over now to Helms and Zach. And again, thank you.
Thanks, Harold. And so we also wanted to highlight another large-scale project and transformation that's going on at the same time that isn't necessarily owned within the same office as many of us here today who handle rulemaking and the programs, but will affect us drastically, which is the implementation of HELMS, which is a new software tool and database. HELMS stands for Healthcare Enforcement and Licensing Management System. This has been a long-term project that's now coming to the go live phase. So just last week on April 24th, the first phase of the rollout happened around HELMS Lite, which replaced the interface for receiving applications from the public. This is the first of 3 launches, again, with the upcoming credentialing launch at the end of the year around December of 2024, and the investigation and discipline side happening sometime in 2025. Applicants will now have the ability to submit their applications via a mobile phone or device, to update a profile, including locating and editing applications, which we expect to have significant reductions in inefficient workload around paper applications and unnecessary call volumes for status updates for information that is readily available. It'll allow folks to delete draft applications, attach their required documentation, and to print payment confirmation and receipts. So we're excited about this initial piece and the gains that we'll get for us. We expect further efficiency gains with the credentialing rollout at the end of the year. And so as this comes through, lots of learning to be done, and there's more opportunity for us to continue to improve. And so we have contact information here for Shauna, for Harold, for myself, for the HELMS team. Please don't hesitate to reach out with questions. We're more than happy to engage. Again, that engaging of the constituents, that listening to our interested parties and making sure that we're being responsive is so key to our success. So thank you again for having us. Very, very grateful for the opportunity to be able to share what we've been working so hard on.
Thank you so much, Zach, Harold, and Shauna. for all the hard work that is going on with OHP. All right. Now for a couple brief slides on our 2023 recommendations for statute and rule changes to reduce the barriers to becoming licensed or maintaining licensure. And I just want to do a quick check. Are we seeing the 2023 recommendations on the screen?
Yes, we are.
Yes.
Eve, thank you.
Thank you so much, everyone. Excellent. I want to thank everyone who participated in our 2023 listening and feedback sessions. Your thoughtful comments and feedback helped us identify major hurdles and develop the recommendations I'm about to share that ultimately became law during the 2024 session. The slide shows the recommendations the department made for the statute changes to reduce barriers. All these recommendations were adopted as a part of the engrossed second substitute House Bill 2047, except for the recommendations to adopt the Social Work Compact, which was included in Substitute House Bill 1939. Effective June 6, 2024, the limitations on the number of renewals for master's level counselor associates and substance use disorder professional trainees will be eliminated. Limitations on training locations for substance use disorder trainees will be removed. Time limits for earning supervised experience for substance use disorder trainees will be removed, and an allowance for master's level counselor associates to continue providing services to established patients while their application is pending becomes effective. Effective October 1st, 2025, a new credential for psychology associates will be available. The Examining Board of Psychology is granted authority to create standards for licensure without exam that reflects the applicant's professional experience. Continuing education requirements for master's level counselors will be removed to rule instead of statute, and the requirement for marriage and family therapist associates to have a portion of their supervised experience under a supervisor with 5 years of experience will be reduced to 2 years to align with all other master's level counselor professions. Effective January 1st, 2028, agency-affiliated counselors will be eligible to practice in federally qualified health centers. As mentioned briefly, Washington has also joined the Interstate Compact for Social Workers. The effective date for this change depends on actions in other state legislation, so we do not know exactly when this will be effective. Currently, we have more than 7 states have adopted the compact, with approximately 20 other states having pending legislation. And again, we must need those 7 states to adopt the compact before it can take effect, and I believe that has occurred. The department also made a number of recommendations for rule changes in our 2023 recommendations. Section 6 of engrossed second House Bill 1724 requires the department to adopt the following changes via emergency rule by July 1st of 2024. Emergency rules are short term, so each project on this and the next slide will also begin permanent rulemaking as soon as possible. All these projects will have public meetings for input for interested parties, and we share those invitations through our email service, GovDelivery. We encourage you to join GovDelivery lists for any professions for which you are interested in getting notifications of workshops or rule sharing or rule hearings. To join any of our GovDelivery lists, visit our website at doh.wa.gov, scroll to the bottom of the page, and click on Sign Up for Sign Up Updates for DOH. First, we have several rulemaking recommendations for substance use disorder professionals and trainees. The department has drafted emergency rules as required by engrossed second substitute House Bill 1724, and they are currently under review. We anticipate the emergency rules will be filed and effective in early summer. The department also filed the CR 101 to begin the permanent rulemaking process. Here we have the rulemaking recommendations we made last year for the master's level counselors and psychology. The master's level counselor program has held workshops and drafted emergency rules, which are currently under review. We anticipate these rules will be filed and effective July 1st of 2024. The department will file a CR 101 to begin the permanent rulemaking process in the next few months. The examining Board of Psychology has also begun rulemaking on these recommendations. The board is working on drafting emergency rules to implement the recommendations and anticipates finalizing these rules at their May 17th board meeting. We anticipate these rules will be filed on July 1st of 2024. Board staff are also simultaneously working on filing a CR 101 to begin the process of permanent rulemaking. They will be holding workshops in the coming months, so if you are interested in learning more or participating in those workshops, we encourage you to enjoy the Psychology Gov delivery list. We would also like to note that we heard many serious concerns in our 2023 listening sessions about the bias in social work, or ASWB exam. We did not have time to sufficiently study the issue and make recommendations last year, but we have been working hard with a group of interested parties in the interim. We will have more information to share about this when we convene again towards the end of the summer to gather your feedback. Today, we are seeking your input to determine what rules or laws continue to present barriers or what barriers persist that we are not able to recommend solutions for last year. Your feedback is essential to us. It will help direct our efforts and make recommendations to the legislator for additional statute and rule changes to reduce listening or licensing barriers for behavioral health professions. Now, we have a few items we'd like everyone to keep in mind during this listening session. Please be mindful and respectful of all attendees and staff. Please raise your hand if you wish to provide verbal comment. And if applicable, state the name of the group or association you represent. Due to the number of participants, please limit your comments to 2 minutes to allow everyone to speak. Also, please stay on topic of the behavioral health licensing barriers. We will keep this slide up during the public comment period for all to reference guiding questions we have provided. Your comments do not have to be specific to one of these questions, but please keep your comments to things the department has the authority to address. For example, we know provider salaries pose a significant barrier for some professions, but the department does not have the authority to affect provider salaries. Also, we want to note that we are here today to hear from you. We will respond to technical questions, or if anyone needs technical assistance on the Zoom, but we generally won't be responding to other questions during this Zoom session. You may put questions you have in the chat or Q&A box, and we will collect them and try to follow up after the meeting, or you can email the program manager for your profession. We have listed the names and contacts for them on the second to the last slide. As a reminder, we are recording this meeting. If you wish to share your comments verbally, please raise your hand using the Zoom hand raise feature, and we will call on you in that order that your hand comes up. If you do not wish to have your voice recorded, please type your comments into the chat and we will collect them for review after the meeting. You may also send your comments to Tori Tarswell via email by Sunday, May 19th. And with that, we would like to invite your comments.
Looks like we have a hand up for Lynn.
Lynn, go ahead.
Hi, my name is Lynn Fainsilver-Katz. I'm on the faculty at the University of Washington in the psychology department, and I'm the director of a master's program in child and adolescent psychology. We train master's level clinicians to work with children and adolescents. One of the barriers that we have noticed is that our program is not CACREP approved. And as a result of that, the students in our program who spend many hours at practicum sites do not have those hours counted towards licensing. That seems to be an unfair factor that impacts only a subset of the workforce. And I wonder if this is within the rubric of your you know, what you have control over.
Thank you, Lynn. I appreciate that feedback. Is there any other comments? All right, I believe Catherine, you have your hand raised.
Yes, I was on earlier today, but I have some individuals that are on this call that I also work with. And so I just want to bring up what I mentioned earlier today in case anyone wanted to add to that comment about on supervision and for the social workers, the requirement to do the 40 hours of group and 60 hours of individual supervision. And that I found it at times burdensome and kind of hard on sometimes the individual that had to kind of carry that. And I didn't know if other people were seeing that too, but I just kind of wanted to put that out there that I find it would be helpful if there weren't so many hours that required the one-to-one, and maybe they could actually do some groups. We could increase the groups. Thank you.
Thank you so much for that, Catherine. Again, or if there's any others that want to add to that, I would greatly appreciate that. If there's any additional support for that concern. Any other comments or feedback that you can provide to us this evening? And I'll just give it a few more minutes to see if there's any additional comments.
We have a hand raised from Ray first, please.
Yeah, hi, thanks. This is really helpful. Really appreciate you guys holding these. So I'm a student, a clinical psychology student, about halfway to a PhD at Saybrook University, which is a non-APA, proudly non-APA accredited school. And what I hear from, so based in Southern California, staff and faculty gather about 4 times a year in person together for these like week-long sprints in order to fulfill the seat time requirement for licensure. And what I hear from my classmates at other who live in other states is that the way their states verify they're meeting that same seat time requirement is very different from how it's verified in Washington. What I hear from classmates that live in New York, for example, is that who has this really similar code, seat time requirement, and they submit the like list of stuff they were at during those weeks, and if the total for their entire education experience adds to the correct amount, right, then Bob's your uncle, they're done. Where from other Washington state-based students, the process I have heard is a lot more litigious relative to that, where in Washington we have to match each specific seat time hour to a credit-bearing course and name the faculty who was present in the like for that hour. It winds up being a lot more specific. Litigious is probably the word. I'm trying not to be mean, but a lot more litigious record keeping relative to the way that the other states verify that compliance with that same rule. I thought I understood that that was part of the changes in 2023, but I was just looking, and what I think might apply to that is marked on your website as pending formal proposal. So I'm curious if that was that amount, that number of seat time hours was reduced, or if the sort of method of verification was altered. But that is the feedback I have for you, is that Washington State does seem to verify compliance with that rule different from the way that other states with a similar rule do the same thing. So that's my comment. Thank you.
Thank you, Ray. And I'm gonna just request our program manager, Nancy or Kaylin, are you able to support some of any feedback tied to this?
Hello, Nancy Delgado. Just to clarify, when you say seat time, are we talking about the residency requests, right? The request to have residency in-person education? Is that correct?
Yeah, that's correct. I just shorthand it seat time, meaning, your butt is in the seat with the faculty member standing in the front of the classroom talking to you about psychology. Yeah.
Definitely. Yeah, so that is definitely one of the areas that we receive comments from the public on reducing, and is one of the areas that the board is looking at making reductions. The decision on what that final number will be, excuse me, will be decided at May 17th board meeting. They have been working on writing emergency rules in order to address those issues. So we do expect to have some form of final decision at the May 17th board meeting. And then if that is voted on by the board, then that would be taking effect in July 1st, 2024 of this year. So I definitely encourage you to attend our board meeting, and then we can have some answers for you at that point. Thank you.
Thank you. Thank you, Nancy.
Wonderful. And Colin?
Hi there, can you hear me?
I can.
Okay, great. Well, thank you for doing this. First of all, I attended the last ones, and I also attended the office hours for the Board of Psychology, which was really helpful as well. I hope that they'll consider doing that again. Couple things. So I'm in the process of trying to be licensed right now. And a couple things I've noticed. One is that it's just the length of time it all takes. So far my application has been in for about 6 months. As far as I know, there's been no issues with it. Sometimes people go back and forth and they didn't get the right paperwork in or whatever, but no issues. And the last communication I got was about 2 months ago, saying that it's being sent to the board to review because it's a non-APA program. And I even got an email back, an automatic reply, when I looked for a status update of due to staffing reasons, we're taking a little bit of time to get back to people. So just maybe more staff or something. The other one is around curriculum. So Washington State, as far as I can tell, has probably one of the more restrictive curriculum requirements for non-APA schools. And so while most have like around 11 domains, Washington State seems to have 15. And so it's become a problem for people trying to apply. I know of 2 people that were rejected in Washington from my school. And I think that the board should really consider lowering those domains. I know there was some talk about it, but I didn't hear about it at the last board meeting, actually doing that. So that I think would be very helpful. And the other one is just sort of like replying to emails would be really helpful. And it feels like there could be just more staff to be able to do that. So I think that's all my comments.
Thank you for that, Colin. So I just want to summarize really quick. So I'm hearing just the timeframes, timelines, and recommendation for more staff, replying to emails, the timeliness of that, also indicating more staff, and then domain lowering would be a comment or recommendation. Are those the 3, correct?
Yeah, so like a little bit about that is like my school there is unfortunately Washington State has a bit of a reputation. People will say things like, "Oh my gosh, I'm sorry you live in Washington State." They take forever to accept applications, and you might not even get it approved in that state. But I also, in the meantime, have applied to Arizona, and my application went through like that. So I've in the meantime got approved in another state, but I have concerns about whether I'll be approved in Washington State, and it's just too bad.
Mhm. Well, we appreciate your patience in their process, and we are working very hard diligently to try to address some of the timeframes and timelines tied to this. So thank you for your feedback. It's very helpful.
Thank you, Eve. I appreciate it.
See some comments in the chat really quick.
Yeah,
There's a question in the chat, Eve, about whether there's a single location that houses our most current forms.
All right, and I'll see if one of our program managers, would you be able to respond to this one?
I don't know if we have one single location that houses all of them, but you can find them in the licensing information under each profession.
Thank you, Lana. So I'll just kind of state that again. We would direct you to really look under each profession for forms tied to each of your professions. And then again, if you have any follow-up questions related to your profession, do not hesitate to reach out to our program manager staff tied to your profession. And do not hesitate to raise your hand or put another comment in the chat. Oh, Colin, great question. Where can I get the email for the program manager staff for the EPB? I think that is Nancy Delgado. Nancy, would you mind putting your contact information in the chat along with Kaylin's email? So Colin will get that addressed for you shortly. And we'll also have that on the second to the last slide deck as well. Thank you, Sherman. And I'll get comfortable with the silence and allow the opportunity for some more questions here. But if we have a pause for a length of time, I'll make sure that we move forward.
We have a question from Lynn.
Lynn, please go ahead.
Yeah, hi. I just wanted to follow up on the question that I asked earlier, the comment that I made earlier, just in terms of, you know, is this purview, this issue of certain, I guess I'm seeing it as a guild issue, that certain guilds have lobbied to have programs that are, for example, part of KCREP have an advantage for their students to get licensed more quickly. You know, we have a dearth of child mental health providers in the state of Washington, and the state legislature has recognized that through some additional funding to support students in order to get licensed as mental health counselors and work with children and families. And I guess I'm wondering about whether that is a sort of it's an equity issue in a way, you know, and I wonder about how whether that is an issue that your board can address. This, you know, the people who are in the room today can address, or is there a different avenue for us to lobby around that?
Lynn, thank you for that. And Brandon, are you available to respond to that?
Nancy, is that something you can respond to?
I think we have Brandon here. He just needs to be unmuted if that's possible.
I wonder if I can just clarify that there, I see the comment that the EBOP determines which programs qualify for licensure, and that isn't really my issue because our students do qualify for licensure and our program does qualify for licensure. It is the inequity in how criteria are taken into account and practicum hours are taken into account.
All right, and Brandon, I'm sorry, we're not able to see you on the panel. So if you are able to type in Teams, I'll just relay. Just 1 second, Lynn, and I will get a response to you. All right, so KCREP accreditation is a statutory requirement, so it need to be a legislative change, we believe.
Very good, thank you.
So
Yeah.
that makes it a very good suggestion for this forum, and we will definitely note it and bring it forward with our other suggestions. So thank you very much, Lynn.
Thank you, appreciate your advocacy.
I'll just give it 3 minutes and see if we can get any additional feedback. All right. If you do have any additional comments and you would like to share but weren't able to share them at this meeting, please send them to Corey Tarzell or myself, and feel free to attend another session if that fits in better with your schedule. All right. So again, I want to thank you all so much for taking the time out of your busy schedule to be here tonight. This information will be very helpful as we work to draft recommendations for improving the behavioral health licensing process. We have, again, 2 more listening sessions, which will conclude on May 2nd. Our team will then spend the next few months reviewing comments, researching, and drafting preliminary recommendations. We plan to reach back out to you all in late summer to get your feedback on the preliminary recommendations before we present them to the legislature on or around November 1st, which will be 2024. We have created a web page as well for this work, and we'll be posting the recordings of these listening sessions in English and in Spanish to our webpage, as well as a video of all the ASL interpretation. We will send out an email via GovDelivery with a link to that page shortly after the listening sessions have concluded. So again, before we go, I want to thank you and also thank our wonderful interpreters for all of their hard work today. And we appreciate your time and your helping making our work more accessible to all Washingtonians. So thank you so much, everyone. We appreciate you.